Good evening, friends. Today I'll be talking about the literature review of my research topic. My research topic is what is the effect of robotic pharmacy on enhanced pharmacy. Basically, how a robotic pharmacy can reduce on medication error. When I was reviewing the content for this particular research, as per the FDA, there are about more than 100,000 medication error cases have been reported per year. That itself is a significance about this particular research topic. I would like to highlight on a couple of researches conducted earlier. The first topic conducted by Cleveland Clinic. The topic is critical evaluation of pharmacy automation and robotic systems, a call to action. This research has been conducted by Mr. Anthony and Bruce. These are the two people they conducted this particular study. In this study, they have clearly defined about the advantages and disadvantages of having a robotic pharmacy. And the conclusions of the study is that national and international professional organizations should facilitate the creation of expert panels to standardize the process related to the evaluation of pharmacy automation and robotic systems. Basically, they are emphasizing about having an expertise panel. The second thing is that this expert panel should describe the core metrics that should be used in these evaluations, including measures related to patient safety and financial stewardship. The third conclusion was research should be conducted at a diversity of institutions, such as depends upon the size and the level of care to better reflect the real world challenges. The fourth conclusion was validation studies should be completed to confirm results from single center studies. These were the four core conclusions of this particular study. There's one of the beautiful study conducted by in Saudi Arabia, basically in King Abdulaziz University Hospital. The topic of the study was an overview of the current state and perspective of pharmacy, robot, and medication dispensing technology. This was a particular topic taken by these people. This team also very clearly defined the advantages of having a robotic pharmacy and traditional pharmacy. I would like to emphasize some of the points in this video clip. The robotic pharmacy can basically help in terms of expiring date monitoring, prescription preparation, stock control, and replacement orders are automated, which which saves a lot of time for the technician and pharmacist. And one of the disadvantages of this robotic pharmacy is itself is a high cost. The technology is very expensive. This is one of the disadvantages of this system. Second thing is that the robotic pharmacies need solutions for items like flammable or cytotoxic medication. It is not compatible for this kind of medication. These are the couple of drawbacks of the system. Where in traditional pharmacy, one of the major advantages is that there is always a personal touch. The pharmacist will be always briefing the patient about the medication and the technique and the antibiotics. So many things. And also there is a personal touch and the empathy factor. It is there. One of the disadvantages of having a this is very important, in our research and the study. The disadvantages of having a traditional pharmacy, the always there's a chances for the medication error. Dispenses can happen because of look-alike or sound-alike medications, interruptions, occupational stresses, complex prescriptions. These are the reason that there's a high possibility for a medication error. And also, the pharmacist had to hand count, fill, cap, and label patient's prescription, which normally take a lengthy time. So these are the advantages that if you can have a robotic pharmacy, the robotic pharmacy will read the barcode system, and it will save a lot of time. The error will not be there much. So I strongly feel that this topic can, if you do a proper study or research on this particular topic, the outcome will be good and helpful to the society. And the conclusion of the second study, which is done in Saudi, is that basically, one more the major disadvantage of having robotic pharmacy is that it will it will eliminate the jobs of the human being. There won't be any human being required in the pharmacy. But the conclusion of this particular study is saying that uh, it will be therefore essential to create AI to work with humans rather than independently. It is emphasizing on having the help of artificial intelligence system along with the help of human. It's not only just not the study is not suggesting to have only a robotic pharmacy. robotic pharmacy, we can take the help of dispensing the medicine, but they are also required the help of pharmacist in terms of briefing, but in terms of um, the moment doctor put a prescription in terms of an OP or IP pharmacy, the robotic machine can read the particular details and bring it to the pharmacist on high priority, which will save time, and it will save a lot of the errors won't be there. So in this angle, I would strongly recommend on this particular topic and do a thorough study, and I strongly believe that it will help the society to have a better outcome. Thank you.